About half of Americans take prescription medicine every day, but about half of those people don't take them as they're prescribed.
This has been projected to cause thousands of preventable deaths and cause an upwards of nearly $300 billion in the US alone.
Even with developments like these, technologies to improve patient compliance haven't done much. Look at prescription packaging. It's been the same since 1970 when a child-resistant cap was added.
Addressing the need for patients to have better tools to help them comply with their prescription medication is what brought us from this to this.
I'm Mason.
I'm AP.
I'm Lindsay Pristow.
And I'm Chinwei. Our project is Redesigning RX, reinventing the way you take your medicine.
Our goal is to discover whether there could be a better way to organize how people take their medicine. Take something like insulin pumps, for example. These are programmed to deliver exact dosages at an exact time. Systems like these also extend to painkillers, like fentanyl, by delivering the medication through patches attached to your skin. To redesign and produce systems like these require years of research and clinical trials and quite a bit of red tape. It requires thousands, if not millions of dollars in funding and ultimately risks being costly to the consumer and to the manufacturer. With this in mind, anything we designed had to be inexpensive in order to make it accessible to a wide range of patients.
So, what next? Another drug delivery device, pill dispensers.
Some, like this one, act as organizers that allow you to group dosages by day or time. There are even companies which, with a subscription, will organize the medicine into dosage packets for you. But a lot of these devices are either complex, expensive, or require the user to do extra work in order to use it. We wanted to design a device that was already compatible with existing prescription packaging.
Our idea was inspired by a Pez dispenser, very easy to use and carry in your pocket, and its delivery system is simple: one push, one candy. We took that concept and merged it with already existing prescription packaging, the bottle cap.
Our device is compatible with the standard prescription bottle, but has an extra feature. It also acts as a single pill dispenser. To use, you flip the bottle, twist the cap, a full 360-degree rotation, and collect the pill. With the basic premise of the device established, we thought about how we might make the device more feasible for use, both for the pharmacist and the consumer. Since our device requires a gripping and twisting motion, our design considerations had to expand to think about people who are differently abled, specifically when using finger and wrist mechanics.
For example, the average elderly person loses about 16% in hand strength and 40% in arm strength from the time that person was 20 years old. To accommodate this, increased traction for an easier grip on the cap is desired. Those with the reduced hand strength to twist, we made an alternative version of the cap, this one with finger notches. In order to make such a device reproducible on a large scale, we would have to answer the bell on making the dispenser adaptable for many different types of pill shapes and sizes.
To that end, we designed an alternative cap. This cap has the same constraints and dimensions as the other iterations and features a new dispenser. In order to validate that our new device works, we tested it using two different pill sizes. First, we tested the bigger pill, and then the smaller one. This alternative cap is controlled, however, by twisting a knob to control the dispensing. Due to the low resistance rotation of the knob, all that was needed was to ensure that there was enough gripping space for the user to hold the knob and twist.
Then we wondered, what else could we do to give users the tools to more easily and more feasibly monitor their intake? We considered the many reasons as to why patients may not be compliant in taking their medicine. Some of those reasons include patients finding it difficult to keep track of the multitude of medicines they have or having difficulty understanding their doctor's instructions on how to take their medicine. We went back to our design criteria to see if we could design another inexpensive, compatible, and feasible design to meet these needs and more. We settled on a counting mechanism that would act as an additional tool for the user to self-track their compliance.
We're still working through iterations of the counter, considering factors such as ease of assembly, ease of use, and making sure we don't over-design the cap.
Designs incorporating a catching device are also in the works, because why dispense pills if you have nothing to catch them with? That design, as well as our other designs, are all made out of plastic in order to keep costs low. We recognize that the feasibility of a product is directly linked to its value on an open market. When we first began this project, it was because we saw an issue and wanted to help. But a good idea doesn't help anyone on its own. The long-term benefit of our design, and any design, is a function of how well the design can continue to be produced. That means we need to make sure our product can generate a profit. So we've decided to look into the economics of prescription medication and see what we could find.
To begin with, in August, the CDC published that 69% of people in the US between 40 and 79 received a prescription drug in the last 30 days. They also found in that same time span, 1 in 5 people in that age range would take 5 or more prescriptions. All of this means that in the US alone, 4.21 billion prescriptions and prescription bottles were used in 2018. If we were looking for a market large enough to support a new product, we found one. However, we needed to make sure that non-compliance is a prevalent enough issue with prescription drug use.
After all, we focus on compliance, so we need to understand the economic burden of non-compliance. We found that drug abuse and misuse isn't just a human issue, it is a fiscal one as well. Through our research, we found a 2013 study that shows a staggering $28.9 billion increased cost in healthcare as the result of prescription opioid misuse and abuse. This becomes less shocking when you consider that an ambulance ride alone can cost thousands of dollars. Therefore, we believe that if we can reduce the number of misuse and abuse cases, even by a fraction of their total, our product is worth the healthcare provider's attention.
We mention this to show that we're thinking ahead. We understand the reality of healthcare, and we've taken steps to ensure that our work is cost-effective and can be manufactured quickly. Our device can't solve all the problems associated with noncompliance. However, our focus isn't on totally eliminating noncompliance. We found that a large number of people who take regular medication aren't given tools to succeed. Many are given instructions and told to adhere to them indefinitely. Our goal is to give people tools to improve compliance and reduce the rates of drug abuse and misuse. We want to provide options for those who take regular medication. Our product can help people, potentially a lot of people. However, it will require a collective effort, which will take years to reduce the problem of noncompliance with medication. With that being said, we're still proud to contribute to that effort nonetheless, and our research has shown that there is both moral and fiscal value to our work.